Welcome to my PowerPoint presentation, Life Cycle of a Claim. Life Cycle of a Claim. The billing cycle of a claim begins when a patient calls a provider to set an appointment and when the services are rendered by a physician. In this presentation, we're going to cover the pre-registration process, the establishment of financial responsibility, patient check-in and check-out procedures, the encounter form, otherwise known as the super bill, the preparation and transmittal of claims, the monitoring of payer adjudication, the generating of patient statements, and lastly, the follow-up on payments and collections. Patient pre-registration. Now, as I stated earlier, the claim cycle begins when a patient calls in to schedule an appointment with their provider. You will need to find out whether the patient calling in for an appointment is an established patient or if they are a new patient. An established patient is someone who has seen the provider before, and they only need to state the reason for the visit because the provider already has their information on file. It's important to update demographic information such as addresses, insurance provider if there's been a change, as well as phone numbers and the employer if applicable. You do this by reviewing the information you have on file with the patient. Now, in cases of a new patient, the medical administrative assistant should get the following information: patient demographics such as date of birth, current address, current employer, current phone number, and insurance information. Depending on the patient's insurance company, a pre-certification or pre-authorization for some procedures or certain treatments is necessary. Pre-authorizations are designed to cut costs. The insurance company makes a decision as to whether the procedure or service is medically necessary to the insured. Certain procedures that typically require pre-authorization are diagnostic imaging, purchase of durable medical equipment, inpatient procedures, infusion therapies, and home health care visits. It's important to receive prior authorization because if you don't, then the patient will more than likely be stuck paying for the entire bill. The medical assistant will need to call the phone number on the back of the patient's insurance card and then provide required documentation so the insurance company can determine medical necessity. You will want to document all the correspondence from the insurance company into the patient's medical record. Establish financial responsibility. In other words, find out who is responsible and who owes what for a doctor's visit or procedure. Is it the patient or the patient's employer, like workers' compensation, auto liability insurance, or third-party payer? Once benefits are determined, the provider will know how much the insurance will pay for certain services and how much the patient is responsible for. Not all services are covered by the insurance company. In this case, the patient has sole responsibility, and they will need to be told before services are rendered. There was a time that I did not always have insurance coverage, and I always asked the administrator what my charges would be for the office visit to pay out of pocket. So always get a copy of the patient's insurance card, if this is possible. Please make sure you make note of the ID number, group plan number, insurance company name, the insurance company's phone number, the insurance name and date of birth, if not the patient. An example of this would be for a minor. A parent or legal custodian would be the insured's name and date of birth. A lot of times, patients are not aware of the insurance benefits, so it's important to know these next terms so you can assist in collecting payments and discussing pre-treatment costs that the patient is responsible for. Copayments is a fixed dollar amount that is set by the insurance company for covered benefits, and it is solely the responsibility of the patient and must be collected at the time of service. Deductible is the amount of the patient is responsible for out of pocket before the insurance company will pay for covered benefits. Coinsurance is the percentage that the insurance company will pay for a service that is shared with the patient responsibility for an additional percentage. For example, 80-20. 80 is the percentage that the insurance will pay for a covered benefit, and 20 is the percentage that is the patient's responsibility. Maximum out-of-pocket refers to the maximum amount a patient must pay in a plan year before the insurance pays 100% for covered benefits. Maximum out-of-pocket resets each plan year or calendar year. Patient check-in and check-out. Check-in is the first point of interaction with the patient and sets the tone for the remainder of the visit. For new patients, the medical administrative assistant will have the patient fill out appropriate forms and get a copy of the insurance card. For established patients, the medical administrative assistant will confirm the information the office has on file. During checkout, the office staff will give the patient an after-visit summary. At times, it will be necessary to schedule laboratory or diagnostic testing. Checkout is usually when co-payments or other payments due on a balance that were not collected at check-in. Follow-up appointments are scheduled as well as answering any questions that the patient may have or that need clarification. Encounter form, superbill. The superbill can be a part of an electronic medical record, or it can be a paper bill. The healthcare provider can submit an electronic superbill that will be transmitted to the medical coder and then sent on to the biller to review for any errors before transmitting to the payer. If the superbill is not completed properly, the medical coder or biller will send it back to the provider for correction. Each healthcare provider creates a superbill to match with their specialty and include the following: patient's name, date of birth, and insurance information, date of service, ICD-10-CM and CPT codes, physician's name, address and phone number, and the physician's signature. Prepare and transmit claim. Each claim form provides essential information like the following: patient name, patient medical record number, that's only for the UB 1450 form, patient account number, patient demographics information, insured member or policyholder, subscriber number, group or plan number, secondary insurance if applicable, prior authorization referral number, service provider name, service provider national provider identifier, also called the NPI, date of service, procedure codes, diagnosis codes, revenue code, and again, that's only for the UB 1450 form, itemized charges, and the number of service or units provided. Monitor payer adjudication. The adjudication process begins when the claim reaches the payer. An accepted claim is one that the payer has deemed to be valid. However, this does not mean the payer will pay the claim in its entirety. A rejected claim is one that the payer finds errors in it due to miscoding or missing patient information. Rejected claims can be resubmitted after corrections are made. A denied claim is one that the payer refuses to pay because the service or procedure is not covered under the patient's insurance, or the policy has a pre-existing clause, and the claim submitted was for services dealing with a pre-existing condition. Generate patient statements. A medical bill is a patient statement. A patient statement should show how much of the fee was paid by the insurance company and the amount due by the patient for their out-of-pocket expenses. A patient statement should be easy to read and understand. List all payment options available. Be clear on the many ways to pay the bill, whether it be by credit card, check, or an option to pay online. Be sure the due date is clearly visible and enclose a notice of late payment fees for payments made after the due date. Secure printing is a necessity. A patient's personal health information, or PHI, should be secure and in accordance with HIPAA guidelines. Statements should be printed and sorted in groups of 30, 60, 90, and 120 days. Some offices will review the balance to see if it is eligible for a write-off, and if so, then the patient should be notified by letter. Follow-up payments and collections. The Fair Debt Collections Practices Act is enforced by the FTC, or the Federal Trade Commission. It prohibits debt collectors from using unfair, abusive, or deceptive practices when collecting a debt. Always ensure that your patients are treated with respect and professionalism. At 120 days, a patient's account must be reviewed to send to a collection agency. Under the Fair Debt Collections Practices Act, debt collectors may not harass, abuse, or oppress any person. They may not misrepresent the amount of the debt, falsely state a person's committed crime, falsely represent that they work for a credit bureau, state that a person will be arrested if they do not pay their bill, use a false name, or deposit a post-dated check prematurely. Debt collectors may not contact a person before 8 a.m. or after 9 p.m. unless that person agrees that they can. A person has a right to sue a debt collector in federal or state court within 1 year of the violation. Attorney's fees and court costs can be recovered as well as damages if the court case is won. All debt collector problems should be reported to the Federal Trade Commission and the Department of Consumer Affairs. Okay, this includes my PowerPoint presentation on the life cycle of a claim. Here are my references I used for research. Thank you for your time.